think it encompasses how you feel about yourself. It's not just like looking in the mirror, right? It's like, how do I feel about me? Do I like Jennifer Roelands? Do I like what I see in front of me? Do I believe I'm a good role model? Do I believe I'm a good mother? Do I believe I'm a good friend? It all has to do with how beautiful, in my mind, somebody is.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Jennifer Roelands, who is redefining women's healthcare through Precision Health MD, a personalized medical practice treating the root cause of illness, not just the symptoms. With an elite academic foundation, UC Santa Barbara, UC San Diego, and Duke University, and board certifications in both integrative and functional medicine, she combines scientific expertise with holistic care to help women over 35 thrive through perimenopause and beyond. In 2024, she launched her YouTube channel to empower women with tools to reclaim their energy, balance their hormones, and promote longevity. Outside the clinic, she's an avid hiker, a foodie, and a proud mother of 4. So Dr. Roelands, welcome and glad to have you here.
Thank you. I'm excited to be here.
Yeah, so let's dive right into it. I'm curious, how did you first get interested in the medical field?
Oh, so I come from a family where nobody went to college. So nobody on both sides went to college.
Mm-hmm.
And my family was very traditional Italian family where women are to get married and have a baby. And so I kind of bucked that because I graduated from high school. Then I went into college and I was kind of in the middle of college going, I don't know what to do with myself. And I ended up going to do worse research through, UC Berkeley in the middle of the Amazon. I was doing ecology research, and I said to myself, I really like working with people, not so much worms. So I'm out here doing all this stuff.
Yeah.
And I applied to medical school, and it just continued on. Like, it's just, you start finding like the people that you meant to be with, and you just sort of continue on that journey and ended up in medical school and ultimately with women's health as an OBGYN.
Okay. So then what led you to transition more into the aesthetic side of medicine? What was the spark for that?
So I see a lot of midlife women, and so you make them feel good on the inside, and then they go, well, what about these wrinkles? And what about, the saggy jowls? And what about, so it kind of was a natural progression to like, I also aged. So as I get into my midlife, I'm 48, I start noticing like, I would like to have a good approach to figuring out how to have great skin now and in the future. And so that just kind of naturally led into that direction.
Okay. And then with your practice, Precision Health MD, why start your own practice? I mean, why not just work for another practice or work for the hospital or something along those lines?
Yeah, so medicine, Western traditional medicine is still the predominant type of medicine that we practice, right? So I practice medicine 3.0. If you listen to Peter Attia, the longevity medicine specialist, it's all about prevention, it's proactive healthcare, it's personalized, it's precision. That's not a mainstream concept. So until more patients and more people kind of get into that field, you can't just join a practice because what you do is very different than what traditional mainstream medicine is. So I ultimately decided, and to be honest, OB/GYN, so I'm board certified in integrative medicine, and there's only like 4 or 5 of us in the state of California.
Oh, wow.
So boarded in integrative medicine, taking a 2-year fellowship and sitting in front of other people to have them test you to make sure you're actually able to understand supplements, herbs, acupuncture, mind body medicine, Chinese medicine, Ayurvedic medicine. Like, there's only 5 of us in the state of California. So it's very unusual. So there's not a lot of us practicing, especially OB/GYNs, more primary care doctors. And so because of that, I had to start what I felt like is what the future of medicine should be, which is whole body, holistic approach.
Okay.
Yes.
So now with your practice, I want to dive a little bit deeper into the specific treatments that you provide to your patients, to your clients. What would you say are some of the most common treatments that they come see you for?
For the aesthetic side or the medical?
Let's go both.
Okay. Yeah. So for medical, because I do, hormone optimization, I see a lot of patients for HRT, TRT. So I see males as well. I do a lot of peptide therapy, longevity medicine. So we really do a lot of understanding data that's personal to that patient to say, how can I feel great now? And in 10 years, 15 years, 20 years from now? So that's that side of medicine is I see a lot of patients who are like, gosh, I don't want to just take a pill. I want to know, like, keep me from falling and breaking a hip in 20 years. I don't want my Alzheimer's my mom has, or I don't want to have creaky bones later. Like, how do I get these things to be optimal now? So that's the medical side. I would say most of it is 40 on up, both men and women that see me for hormone optimization. On the aesthetic side, because I do the opposite with the midlife, I see a lot of patients who we make these personal packages that are really about trying to address inside, but also outside. So it's not just coming in to get your, IPL laser and see you later. I really talk to them, what are you eating? What kind of supplements are you taking? Are you sleeping? Because as you know, if you do anything in aesthetics, if someone does say lasers and then they go eat McDonald's for the next 4 weeks, like we've just ruined a lot of our good awesomeness that we get. So our skin is incredibly connected to what we eat, the sleep we get, the supplements we take. So it's important that they're getting a better holistic approach. So a lot of my patients focus on wrinkles, on sunspots. I'm in Southern California, those. So my treatments are a multi-modality to try to help that particular patient.
Okay. And
Yeah.
I would go over to the health side, go back to the health side. What are the conditions that someone would want to come and see you? Like, I know you talked about the preventative part of it, which is ideal. People are preventing this before it becomes an issue. But I would imagine that most of your patients come into you when there's already been a problem. So what are typically going to be those problems or those conditions that they're facing when they should be coming to see someone like yourself to help them with that?
Yeah, so commonly I'll see someone, say in their late 40s, who's like, yeah, things are changing. My hormones are crazy. I feel I can't sleep. I don't want to have sex with my husband. I hate my coworkers.
Mhm.
My period's all over the mess. Like they know something's happened and they would have seen their doctor a couple times. And it's not really recognized very well, perimenopause, honestly, in Western medicine. We are now, I mean, we're in the middle of a menopause movement,
Mhm.
but it still is very much, most patients are dismissed. Most patients are not offered HRT. And honestly, there was a Forbes study that was done 2 years ago that said only 22% of OB/GYNs were comfortable taking care of menopause women, 8% of primary care doctors. So you can imagine there's patients who go and they're told, oh, go see psychiatry because you're depressed. Go see orthopedic because your joints hurt. Go see cardiology because you have heart palpitations. When really it was all a perimenopause problem, and they needed to have a conversation about hormone replacement therapy. So
Mm.
that would be a very common patient. I also see a lot of patients that are outside the box. So they might have gone to their doctor and they have all this abdominal pain, and their doctor said, oh, it's IBS, take this medicine for the rest of your life. And that patient's like, I don't really want to be on this. Why do I have it? So the number one, I guess, question I always get is why? Like, why
Mm.
is this happening? Why do I have this? Can I not be on this forever? So a lot of times it's a root cause deep dive to figure out what it is the reason you have IBS. Maybe you have a food allergy, or you're lacking nutrition, or maybe there's some other autoimmune issue that's causing your bowel problem. So it's more of kind of diving deep into the why.
Okay. And you have something called a meno makeover. Can you talk a little bit about that? What's that?
Yeah, so I think we focus a lot about, mommy makeovers, right? People have babies and then they want that mommy makeover.
Yeah.
I feel like there's other pivotal point in your life, the menopause, perimenopause transition, where you need a meno makeover, because things are very different. When you get done having children, you still have pretty normal periods, you still have
Mhm.
a lot of good hormones, things are still kind of working a little bit better. And then you hit perimenopause, and that lack of estrogen just does so much changes. You lose volume, you get fine lines and wrinkles, you lose the ability for the skin to really turn over like it used to. So my meno makeover is really trying to target how do we kind of reverse some of those changes that are happening, but also give ourselves some good skin in 5, 10 years. So it really focuses on a combination of doing like peels, lasers, microneedling. I do IV therapy with IV glutathione at the same time, which I love. It's great for your skin. And then I usually will do peptides for a maintenance kind of therapy. So it is personalized, but it's also kind of what typically women in that age group need.
Got it. Now, with hormone replacement therapy, HRT, I want to dive a little bit deeper into that one. So,
Sure.
what is HRT and like when the common woman thinks about hormone replacement, I think most of them, I'd imagine, would think about, oh, my estrogen levels are low or high, or that they're all over the place. It's only about estrogen. But my understanding is that there's also progesterone and even testosterone in women to a certain level. So could you talk a little bit more about that? Because I think most people or women think about, oh, with hormones, it's just estrogen for women, testosterone for men. But for women, it seems like there's more to it than just the estrogen.
Yeah, so, and I use the word estrogen. I'm talking about predominantly estradiol, which is the active hormone. So I use the word estrogen, but remember there are three estrogens that we kind of put those together. So estrogen goes down. So in perimenopause, mostly you start with progesterone declining first because you do not ovulate as consistently as you did when you were younger. And so you lose the ability to make progesterone. And
Mm,
when women lose progesterone first, they start noticing I'm waking up at 4 o'clock in the morning. I'm waking up at 5 o'clock in the morning. I have the rage, right? I'm getting mad about everything. I'm yelling at my kids. I'm yelling at my husband. I feel irritated, annoyed, and just kind of agitated.
mm,
And joints also, progesterone helps with ligaments and tendons. And so people feel a little stiffer, have heart palpitations. So those are kind of progesterone symptoms. And then estrogen begins to fall because when you're not recruiting an egg every month to ovulate, then you don't really have a reason for the ovaries to make estrogen. So they start making less and less and less. But the bummer part about estrogen is it's in a roller coaster. So
mm,
that's why women in perimenopause are like, I feel fine. Oh my God, I want to burn the house down. I feel great. Oh my gosh, I hate everybody. Like they're like back and forth because they don't have this like nice low, declining. They have this roller coaster. It feels like chaos.
mm.
I can personally tell you that at 48 years old, that's what it feels like. And
Yeah.
so this kind of decline also affects like other hormones in the body. And so women will notice like, why is my hemoglobin A1C like I'm becoming insulin resistant, like a pre-diabetic, and my cholesterol is going off, and now I'm getting high blood pressure. Like all these things start becoming a domino from estrogen going down.
Mm,
Testosterone, interestingly enough, actually goes down with age, but it's not perimenopause is not like a pivotal drop, if that makes sense. You can see women in their 30s who have low testosterone.
mm,
The reason we don't focus on it is because there's no FDA approved product for females yet. And so because of that, people kind of ignore it. It's like the third kid, like, oh yeah, the baby of the group, right? Like, oh yeah, she's still here. We got we gotta. And I actually usually describe estrogen and progesterone as testosterone like three sisters. Like
yeah.
estrogen is definitely the setter of the three. She's the eldest. She's the organized one. She keeps the other two in check. Progesterone complements estrogen. Sometimes she gets ignored because she's the middle kid, but she's
Mm,
actually just as valuable as the oldest.
mm,
And then testosterone's kind of a little bit of the wrecking ball. Like if you have low testosterone, all these other things start kind of happening
mm,
because testosterone is important for your brain, for libido, for focus, for energy, and for muscle, building
mm.
muscle. This is why guys take it when they're younger because they want to build muscle. So we have testosterone just like males. In fact, we actually have higher per nanomillimeter per liter when we're younger, but it declines. And so I am a big fan of augmenting testosterone if someone has low testosterone.
Okay. So, and I would assume that in almost all the situations, it's typically they have lower levels and you need to raise those levels up. Is that correct? Or
Mm-hmm.
sometimes is it they have high levels, you need to bring them down?
Not usually. Most of the time, with that up and down estrogen roller coaster, there are certainly times in perimenopause when the ratio of your estrogen is so much higher than your progesterone.
Mm,
In alternative medicine, we call this term estrogen dominance, but that term does not exist in Western medicine. There's no such thing.
mm,
So it's not that it's higher per se, it's that the ratios are off. And so it
mm,
feels
mm.
like you're having more estrogen, high estrogen symptoms like breast tenderness, acne, gaining weight. Those are because that ratio is off.
I see. So then
Mhm.
how would you go about solving that issue with the estrogens going up and down like a roller coaster? Are you just trying to keep estrogen at a high level consistent, or how are you dealing with those highs and lows?
Yeah, so that's what I tell patients because oftentimes they're like, just give me on everything, right? Put me on all three. Like I'm 46, and even though I'm having a period every 6 weeks, like throw it on me. I want it all.
Yeah.
So I kind of remind them that if I give you estrogen and you're not quite ready for it, you're going to have two highs of highs, right? You're going to
Mm,
have a lot of time. You're going to gain weight. You're going to have acne. You're going to have breast tenderness. You're going to be emotional like you were 15 years 15 years old, when you were like, oh my gosh, Joe didn't call me. Why didn't Joe call me? Like you're going to feel that way, like a 15-year-old girl. So we use, the clinical guidelines now say to use symptoms to guide by someone's symptoms. When I know someone has enough symptoms that indicate low estrogen, then I'll add estrogen in a perimenopausal female. Postmenopausal, they're all low. So
Mm,
you can, you're already done with your period, bring
mm,
it on, girl.
yeah.
But beforehand, when in the roller coaster time frame, I try to do stacked therapy where it's first progesterone, then estrogen if you're needed, and testosterone. I always check blood tests to see where you are.
Okay.
Yeah.
And then within this treatment, how much do the other, I guess, solutions come into play, like supplementation, sleep, exercise? Like, is that something that's also a really important part of it? Or is it kind of more as like, oh, this add on, like, well, like 90% is hormones, but then there's other 10% is other stuff?
No, 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 no. I don't take off my integrative hat. No, no. It's because to be honest, metabolism of estrogen requires liver and gut. So if you're, again, have a poor diet, you're not sleeping, you're super stressed out, HRT is not going to work. It's just not going to work out. It's going to be very difficult to get happy with just that. So it's incredibly important for not only that moment but lifelong, so that we're watching people's metabolic health. We're looking at sleep. We're looking at their bones. Like, what do your bones look like? What do your muscles look like? What does your brain look like? Like those things are all incredibly important long term. You can't just add HRT and say, see you in 20 years. It's
Mhm.
gonna things need to be looked at from a holistic or a whole body approach.
Okay. And when it comes to the hormones specifically, I know there's different ways of applying the hormones. Like there's the injections, there's the pellets. I think there's things, I don't know if you can take it like orally or something like that, but like out of all these different modalities of taking it, is there one that you would recommend, or is it going to be dependent on every single person or every single situation?
So some of it depends on age, right? So if you're taking an oral estrogen, then you have a little bit higher thrombosis or stroke risk related to that. So I would not start like a 65-year-old female on an oral estrogen because by 65, their blood vessels are already stiffened quite a bit. So they're at higher risk for heart disease to begin with. So that would not be my first choice. So
Mhm.
the health of the patient is important, the age of the patient is important, what they choose. I've had patients who are like, I don't want a cream. It's too messy. Like I want a patch.
Mm,
So personal preference is important. And then also because I live in both, alternative medicine and Western medicine, I have some patients who want to use insurance. So they use certain options. And I also do compounding for some patients. So I kind of like have the conversation first. What are the things you're a candidate for? Okay. I can't say I'm 50 years old. I'm a candidate for all of them because I'm healthy. So
mm,
you have options with oral estrogen, patch estrogen, cream estrogen, and then you have local options. You can use a vaginal ring, vaginal cream, vaginal suppository. So there are a lot of options for there. Progesterone is typically given oral because most people can't sleep, and the oral version actually helps the best. For the metabolites of the oral actually help sleep. The data also says that transdermal or cream is not really recommended from a Western medicine perspective. So I typically stick with oral in
mm.
general.
Okay.
And then testosterone, there's no FDA approved product. So you either have to use the male testistem and give them a smaller dose, or you compound. I typically like compounding because then I know exactly what they're getting. Because if I tell a woman, like, here you go, take a ketchup packet and take a tenth of it, they're like, what's a tenth of a ketchup packet? Like, it's just kind of harder to like. And if you're kind of really savvy, you'll pull it into a syringe and then you'll try to do zero point 0.1. I mean, you can get more savvy, but most of my patients are like, I just want to click and then it turns into my dose and I'm good.
Mm,
Do you
okay.
know?
Yeah.
So that happens where people will do that. And also the testistem, some of the alcohol, I mean, sorry, the male versions have alcohol in them because they absorb like that. So some women don't like the drying effect too. So it just
Mm,
depends on the patient. But for me, I use those. There are pellets available. So you can do estrogen or testosterone in a pellet, but I don't typically do a lot of pellets unless they've tried those other options first, because pellets tend to be higher in general, higher doses. So if you've never been on HRT, going straight to the top is probably not a great choice. You need to
mm.
start trying to see how you respond to wherever you are.
Okay.
Yeah.
And what would you say is some common misconceptions that you hear or myths that you hear about HRT or anything kind of within this vein?
Oh my gosh, there's a million of them.
Mm-hmm.
The most common is it causes breast cancer, which
Mm-hmm.
is not correct.
Mm-hmm.
In fact, this week we are doing this interview, and the FDA took the black box warning off of estrogen on Monday. It's been there for 23 years. It was
Wow.
misinformation from the WHI study,
Mm-hmm.
and doctors petitioned it, and they took it off this Monday, this couple
Wow.
days ago,
Mm-hmm.
which is amazing because that never happens, right? They
Yeah.
don't ever.
Yeah. They're not going
So
to guilt.
yeah, yeah. So the insert for all estrogen products used to say will cause breast cancer, stroke, heart attack, heart disease.
Mm-hmm.
That's off.
Wow.
It says please consult your doctor. Like talk about your individual risks. So that's a huge momentum because that's misinformation from an old study that's been debunked several
Mm-hmm.
times. The other thing I hear is I'm too old for estrogen. I'm too old for hormones. I'm 60. My doctor told me I'm too old. That would be another misconception. Other would be that I can't take them in perimenopause. I got to wait till I'm in menopause and I've had 1 year without a period. That's inaccurate. There's no contraindication to have someone who's 49 still having a cycle and who's 49 doesn't have a cycle. Like
Mm-hmm.
it's still hormone replacement therapy. So that's a misconception. And then I think lastly, people feel like I see a lot of patients who might be kind of dismissed by either their mother or their sister, kind of like it's not natural.
Mm-hmm.
Like, oh, I went through it. Why can't you suck it up, buttercup?
Mm-hmm.
That kind of pressure from other people that you should just, this is natural. But, we didn't live 30 years past menopause, 60 years ago. Like we're now living on an average age for women of 81.1. Like that's 30 years
Yeah.
in menopause. So, I mean, the advancement of science has been great. Penicillin's great. Surgery is great. Like we can do these things, we can live longer.
Mm-hmm.
So therefore, does someone want to live a third of their life without that? I don't think so.
Mm-hmm. Okay. And so let's say someone is looking for this type of treatment, but they don't know anybody around, like, and they're looking for a good provider that has the knowledge, has the expertise, and can really help them get what they want. What would be the most important piece of advice you would give to that person as they're doing their search?
I would say, do they take care of perimenopause and menopause women? A lot of OBGYNs focus on reproductive age women. Like you go into the waiting room and they're all pregnant women sitting with you.
Mm.
And so they have a very minimal amount of the practice is doing this. Most of what they're doing is delivering babies. So their focus isn't really on that. So I would ask, how many perimenopause women do you see? Like
Mm.
what is your normal demographic of your practice? Because a lot of times they're focusing on the reproductive age women. To what options do you offer? Because if you call them and they say we only do pellets, I don't think that's a great place. It should be that they offer all options and it's your choice with guidance onto what's the right choice for you. So it needs to be that you're getting true informed consent. You've been offered creams, patch, gel, everything, right? So you have all the options because you want to make sure that you have a real true conversation about what's available. Because I think sometimes in the alternative space, there are people who just do one thing. Like they may only do herbs or they may only do pellets or they may, they kind of, we only do compounded cream. We don't do anything else. It's like, well, there's many options available. You have to be educated in all of them. I
Okay.
think that's important.
Okay. And what role do you believe creativity plays in how you approach your patient care?
I think it's really important because I'm not here to tell somebody what's right for them. I think what's wonderful is that the patient says, this is kind of my moral compass. This is kind of what I was thinking. What are the things you think would work? So there's a lot of like creativity on that person's plan. Because there are patients who come into me, they're like, absolutely no HRT. It's terrible. I'll never do it. It's the worst thing ever. And then we start talking about it, they're like, oh, I didn't know any of that.
Mhm.
And it's a whole different approach by the time we finish talking. Or the opposite, they come in thinking HRT, and then I tell them, well, there's also herbal therapy. There's also intermittent fasting. There's also, and then they kind of go, oh, okay, I've never heard any of this stuff. Like maybe I want to try that instead. So you have to be somewhat creative and flexible to make something that to me, I sort of think of myself as like they're the CEO of their healthcare. I'm like the guide helping them, right? Like
Mhm.
ultimately they're the doctor.
Yeah.
They get to make the decision for their own health.
Okay. So sometimes it's just a matter of trying to break them out of their mindset that may or may not be wrong and just going over the benefits of, hey, this is the best option for your health where you are right now.
Yeah, here's all your options, right? You can choose which resonates with you.
Okay.
Yeah.
Now, Dr. Roelands, I'm sure that throughout your experience, you've had some either memorable or challenging cases. Is there maybe one story that you can share and how you were able to get a great outcome out from it?
Oh wow, man, we could be here all day. I had a very, well, I would say kind of, which one would I choose? This one I'm going to say because this is really important. This patient came to me. She had been having symptoms. She had been very depressed, anxious, wasn't really sleeping very well, was feeling like she actually was an executive for a very high-powered company. And she had lost her job. She was 52, had ended up living with her mom, and her mom and her came to this consult, and they were like, we got to do something. We've spent 2 years seeing all these doctors and no one can help me. And I feel very helpless. I used to be incredibly efficient and productive and high profile person. And now I can't do anything. I can barely shower.
Mm.
And so when she started explaining all these symptoms, she said to me, I said, when did all this start? She's like, 2 years ago. I'm like, okay, so you were 50. Did anything else happen? Like you stopped having periods? Like, I mean, so when we kind of started talking about menopause, it started clicking for her that, oh, yes, all of this started happening when I started noticing all these hormonal changes. But for her, she had spent 2 years seeing other providers. And so she was so ingrained that they had told her, no, you're just very depressed and we really can't help you anymore. Like she had a hard time bridging that gap. Like, oh, this actually might be, I never talked about this with anybody else. This might actually be a thing. So it took a little while to break down those like preconceived beliefs. You know, she came to me for an alternative to depression meds. Like, can I talk about what we can do instead of all these depression meds? And I'm like, I think maybe it's actually menopause.
Mm-hmm.
So I ended up putting her on estrogen and progesterone, and I met her a month later, and she was showering, she was doing yoga, and she was making food, which she hadn't done any of those things very well in the last 2 years.
Wow.
And then I met her about 6 months later, and she had a boyfriend, and she had moved out of her mom's house.
Mm-hmm.
And it was a whole new person. And
Wow.
this person was put on multiple depression medications,
Mm-hmm.
a lot of benzodiazepine, lots of like, just, I mean, if you could just look up all the things in the book, it was like everything. And she had kind of, and she even flew to like Turkey. She flew to all these other places to try to get help, and no one really connected that all of this started in menopause for this patient, this person. So she did really, really well. She was somebody that I was just like, whoa, here's the power of how this can just derail your life
Mm-hmm.
without proper treatment. And I ultimately actually talked to her about 8 months after we had started, and she mentioned to me that I was her last consult, that she was not planning on continuing to live.
Mm.
And it
Wow.
shook me to my core because she never said anything, right? And I felt like, oh my gosh, like
Wow.
I'm glad in some ways I don't know the pressure of what that was, but I also wish I would have known, you know, to sort of done that. But she was just, oh, she was over it.
Mm-hmm.
So it was very rewarding that she had an answer, and very rewarding that she could see that this was something that had happened to her. Like
Mm-hmm.
this stuff had happened to me, and that's how it manifests in my life.
Mm-hmm.
As opposed to, I think sometimes people are like, oh, just suck it up. Everybody's gone through it. It's like not everybody's gotten to that level to where they can't function, you
Yeah.
know?
And I can only imagine just how frustrating it is that you've gone to see all these experts, no one can find the answer, and just it's just at the end of it's like you don't want to be like that anymore. So it's incredible like how you're able to turn someone's life around just with the right diagnosis and then being able to help them solve it.
Well, you know, if you know Oprah's story, I mean, everybody knows Oprah, right?
Mm-hmm.
She did a menopause revolution story about a year ago, and she has unlimited money, unlimited resources, right?
Mm-hmm.
She went 2 years with heart palpitations.
Oh.
She saw every cardiologist. She had a bazillion-dollar workup, everything, and no one connected to the dots until she
Mm-hmm.
said she was sitting and reading an article about menopause.
Mm-hmm.
And they said heart palpitations. She was like, this is me. And here's somebody who has no lack of resources.
Yeah.
I'm sure her doctors are very esteemed and well sought after, but yet that was missed.
Yeah.
So you can imagine this happens in all different areas, that it gets dismissed, and and people don't really connect those dots, and yet here's somebody who has every opportunity in the world and didn't get a correct diagnosis.
That's insane to think about that. If someone like that has trouble finding help, like what chance do the rest of us have?
Well, we need more education. We need doctors to catch up with the fact that the WHO study is well over, and they need to be educated. We need patients to feel like they could talk about it, not feel like people are shaming them because it's not natural or whatever that, I hate that term, natural. And so that just needs to continue to be in the forefront. And we are in the middle of a menopause movement because aging celebrities my age, I don't know how old you are, but they're like, forget this.
Yeah.
Like Naomi Watts and Halle Berry and Drew Barrymore and Oprah, they're like, no, this is not cool. I would like to do something different. So that's breaking that barrier of communication.
Okay. And with that, where do you think the future is going for this field? I guess I call it wellness or hormone therapies.
I think that we're going to get, a lot of us are focusing on teaching the younger generations about how to, because when I was in residency 17 years ago, I'm an OB/GYN and I had no menopause education. I remember my attending telling me, you're never going to need to know any of this stuff. We're not giving hormone replacement therapy. Nothing to talk about here, like nothing to discuss. So people like myself and a lot of people in this space really want to get to the younger generation to teach them, like, this is important to understand what happens to a woman, what can you do differently. So the education, I think, is going to happen. I do think that patients or clients, however you want to describe yourself, are demanding better. I mean, they're every day going to telehealth option here, direct to consumer options. Like, they're learning more, especially Gen Z, man. They are like, nope, I'm in my late 30s. We ain't having this. So I think it's great because they're pushing the envelope to say, I don't want to deal with that. Like, you boomers or Gen Xers like me, y'all are just sucking it up and I don't want to. So I think that's important. So I think that'll change as more patients and people demand better care. More doctors go, oh man, I got to do something about this. I need to learn and understand. And I think they'll become more of a standard to what to do with hormones. I think right now it's a little wild westy where you can go see anybody. I don't know, we'll do 17 supplements here, we'll do a pellet here, we'll do HRT here. Like, it just seems like it's all kind of like personal preference. So I think there'll be more of a strategic plan going forward.
Okay. And so for your practice, Precision Health MD, what's your vision for your practice?
My vision is to practice medicine 3.0, to help people live awesome now and in the future. I really see things. I'm a big fan of Peter Attia. He wrote the book Outlive. He's in longevity medicine. I love that type of medicine. And I like the idea of thinking of, what do I want to do in 40 years? How do I set up what I do now to be able to achieve that in 40 years? So that's the kind of projection I would like to continue to build in my practice. And then, from the aesthetic side, I really want it to be more of a personal approach to people when they come in to see me and they're like, oh, get rid of these wrinkles. I'm like, yeah, but let's talk about what kind of things what kind of serums are you using? Do you use estrogen on your face? What do you want? What is the bigger outcome that you want? You know what I mean? Because it's not just about giving them Botox, right? It's about also trying to have a more sustainable plan. If you have better skin, it's going to be less wrinkles long term, less issues long term, less sagging, if we can just fix some of those other things internal as well.
Okay. Now, Dr. Roelands, I have one last question for you, but before I ask it, I want to point people to your website at precisionhealthmdoc.com.
Yeah, Precision Health MDOC is an Orange County.
MDOC, okay. I'm like,
it's all
this is
good.
something here. Like, I was reading, I'm like, MDoc? It's like, okay, MDOC, that makes a lot more sense now.
Yeah, you know what I often say, I'm the CEO of my company, and so sometimes people go, she's the SHEO. I'm like, no, it's CEO instead of CEO.
Okay, so it makes a lot more sense then. Okay, so Dr. Roelands, last question for you. What does beauty mean to you?
Beauty is feeling like you're glowing from the inside and the outside. That's what I think it means.
Can you explain a little bit more on that one?
Yeah, so I think it encompasses how you feel about yourself. It's not just like looking in the mirror, right? It's like, how do I feel about me? Do I like Jennifer Roelands? Do I like what I see in front of me? Do I believe I'm a good role model? Do I believe I'm a good mother? Do I believe I'm a good friend? It all has to do with how beautiful in my mind somebody is. I mean, there are people that I find very beautiful that aren't, Kim Kardashian, right? Like I find them just to be attractive from a personality standpoint or a beautiful person. And I think that it matters who you are, not just kind of what we see in the mirror.
Okay. Well, there you have it. Dr. Roelands sharing her expertise. So, Dr. Roelands, where can people contact you in your practice?
So we have a website that you mentioned. We're on Instagram also with the same handle, Precision Health MD. I do personal speaking engagements and all kinds of stuff nationwide. So I have my own Instagram, Dr. Jennifer Roelands. And then I have that YouTube channel, which is also drjen.md, where I do videos on perimenopause and menopause and women's health and that kind of stuff.
Awesome. Well, Dr. Roelands, this was awesome. Thank you for coming on, and thank you for sharing your message and your knowledge.
Thank you so much. It's been awesome.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.